how do we differentiate between this evil eye or somebody is possessed? Because back in the days, if somebody actually had a depression or going through anxiety or any psychiatric issues, uh, people used to think he was possessed or was affected by an evil eye, but nobody paid actual attention. So they used to go to the spiritual healers, and I'm not sure how effective or accurate the treatments were, but there was no concept of this psychiatric illness or mental health issues back then.
So where Islam failed, where the Muslims, I want to say I want to say Islam failed, where Muslims failed was when they started thinking that they could do everything themselves. Remember, scholars in the past, when they studied Islam, they studied astronomy, they studied medicine. Everything was a complete package. Majority of the stars in our galaxy were named by Muslims, right?
Right.
They had the complete package. The House of Wisdom in Baghdad was where people of different religions came together, shared knowledge, and they enriched themselves. Where I think our Islam took the wrong turn by means of Muslims taking the wrong turn was when we separated Islamic scholarship from the sciences of what we've called academia, right? Or we call it, the secular studies and Islamic studies. That concept didn't exist until the colonization of our countries. Before that, it was a complete package. What's happened is now we, as a Muslim society, demonize, oh, yito Islam, para these people have learned Islam, like they're nothing. But this is a doctor, engineer, there's someone. But what we're doing is we're actively playing into breaking our society. You need both. If a person can be a doctor and a scholar, is great. That's what people used to do in the past. But if not, we can't say one is better than the other. So coming down to this answer, because this is important to understand the history, is that scholarship today is basically, I know everything and I'm not going to consult you. So when cryptos became a discussion, scholars off the bat, haram, haram, haram. But did you consult with an expert? Did you sit down and just hash it out, like throw on the table? This is what blockchain is. This is what cryptos are. They're based on the value of something. Is it just, is it tangible, non-tangible? Like have the whole discussion and then write up a paper, say, from the scholarly perspective, after consulting expert, this is my scholarly opinion. We lost that when the Indians in Deoband started saying microphones are haram, because you can't use it for prayer, or you can't listen to radio or go on TV or watch TV. Today, that same segment, and I'm saying it because I've come from a Deobandi line of studying, today they're the ones going in front of cameras. So what just happened here? We can't just write things off the bat. Many of the people we call spiritual healers, were they spiritual healers? Were they consulting with mental health experts? In what way? That this person coming to me is truly possessed. And that's a fact. It happens. Jadoo or black magic happened to our Prophet Sallallahu Alaihi Wasallam. Nazar, our Prophet Sallallahu Alaihi Wasallam said that evil eye is haqq. Evil eye is true. So we cannot denounce that being a reality. However, a person who understands their zone will say, this is not for me, I'll hand it off to the service expert. Or they'll say, this isn't making sense to us according to medicine, let's consult with a scholar. That collaboration is gone. And so that is one of the main components why we have this mindset. People say, oh, you just have jadoo on you, or you've been possessed. Without factual information, without collaboration, we're not getting a solution. And that's leading to this problem that you're talking about. People in society don't want to accept this being a problem because they feel they'll be segregated from society. Well, this person is jadoo, stay away from them.
Well, just to add to that too, in psychiatry, so Iman, I agree with you, because in psychiatry, that's how we talk about, we divide our treatment into three parts: biological, psychological, and social factors.
Sure.
Because these are the three factors that you have to look at it. And it, like you said, it entails the whole, everything, the whole concept. So then if you get the biological pieces, that's what that's what the part of it you talk to a physician where they're looking at, is there about chemical imbalance that's going on that's causing these symptoms? And so that's what that biological part is. Psychosocial part is, that's where you talk about looking at the psychological piece, like what are some of the causes that the interrelationship that may have affected this, like the marital relationship, the relationship that's with your parents, that could have created that stress, created this depression and anxiety. The social factors, socioeconomic factors where you are in there. So it's that whole concept is what, you when somebody comes to my clinic, that's what we're evaluating, that's what we're looking at. We're looking at the whole biopsychosocial factors, and that's how my treatment plan is based on. So alhamdulillah, so that's what we do when I see a Muslim, and also research have shown that people who have like suicide tendencies or suicidal thoughts, that if you have faith, you're protected.
Yes.
It's research based. They have done research and looked at, okay, what are the protecting factors somebody who has attempted suicide or who has committed suicide? What were that? So one of the big factors is a faith, like somebody who believed in higher power. That doesn't mean they have to be Muslim or Christian. Somebody who's believing in higher power. So if you have that, you're protected from committing suicide. So again, this whole biopsychosocial factor is very important. We have to integrate. You can't just, like you said, divide. It doesn't exist. That's why I agree with you, because a lot of times we see in our clinic two types of patients. One, they come in, they say, we don't want to see a therapist. We don't want to go anybody to religious leaders. We want to come to you, give us medication, and we just want to treat our depression with our medication. And that's all they focus on, medication, medication, medication. And then we have other people that come in and they're like, they come to me and say, well, no, I don't want to be on medication. Only medication I want to take is something natural. I want to be on my vitamins, or I want to go to a therapist, and I don't want to do nothing with the medication. So I get these both kind of patients, and those are both difficult patients. And I have seen them, and their prognosis is pretty poor.
Yeah.
But ideal person who comes and talks to me and tells me open-minded to my feedback, he'll look, I'm going to look at chemical point of view and say, evaluate you. Where is your depression? Do you need to be on antidepressant? Do you need this? And then, okay, let's evaluate it for that. And then I'm going to refer you to a therapist, somebody like you mentioned earlier. That talk therapy, that person touch is so important.
100%.
And you mentioned that earlier about, yes, 100%. In psychiatry, you have to have that. And that's one of the reasons why we're seeing this, because we're a society, very black and white. We don't have that human touch anymore.
No.
And that's why we're seeing the good, like you asked earlier, question about why we're seeing so much of it. So that's why we recommend therapy. And then the other piece is, like, if you have your, whatever your faith is, we recommend definitely going to see your religious leader, talk about this. So if they do all of this, usually they end up getting better, and the prognosis is much better. It's that holistic approach you have to have especially in psychiatry. I know every aspect of medicine needs to have holistic, but specifically in psychiatry, yes, definitely. So I 100% validate and agree.
Yeah, I think that's a great thought, right? So we, as Imam mentioned, as a modern society, we need quick fix, quick solution to the problem.
Yes.
And we probably are not receptive or educated to look at the 360-degree angle, as you mentioned, right? So the problem is not solved only my way or the other way. It's more about kind of getting everything in conjunction and see what fits the best. More kind of like customized approach for an individual patient.